from overseas.
From this evening onwards, the service formerly provided by Take Care Now has been taken over by a new operator. They're called Harmoni. They will answer calls from patients who need to see a doctor overnight or at weekends in Suffolk, along with parts of Essex and Norfolk. The switch follows national condemnation of the cover provided by TCN, which in one case led to the death of a patient in Cambridgeshire. Let's get the details now from our chief reporter, Kim Riley.
This is the brand new Ipswich call centre set up by Harmoni to take calls from all over Suffolk. It actually went live literally just a minute ago, and the first calls are already coming in from patients. If you live in the Great Yarmouth and Waveney area, or indeed in North East Essex around Colchester, you also probably know the name Harmoni. They're delivering the service there. Delivering that service in such a rural region as this one is never going to be easy. Ask the public if they have confidence in out-of-hours services, and as usual, you get a mixed picture.
Not very good, because you call them and they don't come out to you. You have to try and make your way to see them.
I've never had a bad experience when I've used it, and I've used it more than once with my children.
Mostly you get a telephone call from a foreign doctor or something like that you can't understand.
Harmoni's won a 5-year contract to run out-of-hours services in Suffolk. Its predecessor, Take Care Now, was castigated by a coroner after David Gray from Cambridgeshire was given a fatal dose of painkiller by a German locum.
Press conference, press 9999.
This afternoon, final preparations of a new Ipswich call centre. It promises to be a busy weekend, and they say they have the staffing to cope.
We will have all of our 9 visiting cars out, going to patients' homes. We will have all of the 10 primary care centres open during Easter at certain times. They will have doctors. So a total we would be averaging up to 26 doctors across Suffolk.
Hi, could you look at this for me, please?
Yeah, certainly.
Debenham GP Paddy Fielder has been a shareholder in TCN. He believes Harmoni faces a big challenge.
I think the principal problem is going to be in recruiting doctors. The other thing is I'm not sure where their centres are going to be placed, but they need to be placed widely around the county so that no one has to travel more than about 30 minutes in order to get to a doctor. Thirdly, I think the main problem is going to be starting over a bank holiday weekend. On a Friday night with 4 days of no general practice available, I think is going to be a real baptism of fire.
It's certainly going to be a marathon. They're going to be manning these phones right through till 8 a.m. on Tuesday morning, and the company says it's expecting high demand right across the Easter weekend. Susie, back to you.
Kim, thank you very much. Well, let's talk now to Andrew Gardner, who's Chief Executive of Harmoni. It is going to be a baptism of fire coming in on an Easter weekend. Are you sure you're going to be able to cope with the 4 days ahead?
Yes, I mean, we've had quite a bit of planning time, and it's very common for us to take over a service on April the 1st, and then fairly soon after that there is usually Easter. I mean, it's absolutely right, Easter and Christmas are our toughest periods of time, but the most important thing for us is to get the rotas filled, and at this point in time I can assure you that the rotas are either full or close to being full over that period of time, so we're confident.
One of the main criticisms we had from viewers about the service from Take Care Now was that there wasn't enough doctors on call at any one time. Can you guarantee that you will be providing more doctors and in more locations?
Yeah, I mean, we're now, as was said on that earlier clip, we're now going to have 10 locations, so that should make access to primary care centres easier. We're also going to have 3 doctors overnight as opposed to 2, and if necessary we'll have 4. And the other thing is, we'll make sure the rotas are full, because our understanding was, actually a lot of the pressure on the system was that the rotas weren't full. So therefore it put more pressure on doctors working in the service, that they had to sort of take up the slack from other doctors not being there. So one of the big things for us is make sure we get those rotas full.
What about this issue of recruitment of doctors? Because are there not enough doctors locally to cover demand, and why we've had to see doctors coming in from abroad in the past?
I think it's always more difficult in a rural area, but it certainly seems at the moment that in this area, because doctors have lost confidence in the provider, they're not going to work in the service. So we've been visiting GP practices, we've been talking to GPs, listening to why they're not working in the service, and we feel confident that as we build up confidence with the doctors, then they will come back to work in the service. So for instance, we're going to have a GP advisory board, and they will advise us on the sorts of things we need to do to make sure they work in the service. And one of the biggest things is make sure the rotas are full, because people weren't working in the service because they didn't feel it was safe. So getting a safe service is right for the patients and right to get the GPs back in.
We've run out of time. I know you wanted to say don't all ring at 9 o'clock on a Saturday morning, because that is what people tend to do, but
yeah.
Thank you very much indeed.
That's a pleasure.
For coming on, Mr. Gardner.
Now, you know an election is coming when top politicians start kissing babies. Today we had a kissing in Bedford during a visit by the Foreign Secretary. Our political correspondent Andrew Sinclair was there.
When you're on the campaign trail, it's essential to be photographed with children. And there were plenty on hand for David Miliband's visit to a Sure Start centre in Bedford.
And has it made a difference for you as well to feel that you've got other parents that you...
Yeah, it's a good place.
The father of 2 adopted young children, he was clearly in his element. It was only a matter of time before someone got kissed. The honour fell to 5.5-month-old Madison. After expenses and lobbying scandals, the politicians face an uphill struggle to reconnect with voters in this election. Even among people here, there was a fair degree of cynicism.
There are some very good MPs around, but unfortunately the impression gained is that they're the minority rather than the majority.
You don't really see a lot, in my eyes, that is happening, apart from lots of people getting made redundant and stuff.
I think it's not some of people's confidence, but I will be voting.
There's huge cynicism and scepticism about politics, and we have to show in this campaign that politics is indeed a noble cause. We have to break through the cynicism and the scepticism. We have to listen. We have to be humble about what's gone wrong, as well as full of pride about what's gone right, and we have to really try and map a positive course for the country's future.
He continued his theme in Luton South with an off-camera visit to some floating voters and an on-camera discussion with some local residents about diversity and unemployment. Politics needs cleaning up, particularly in this town, he said, a reference to the local MP, Margaret Moran, who's standing down. If Labour lose this election, Mr Miliband could be the party's next leader. This was an important visit to a seat, which, because of the controversy surrounding Margaret Moran, has been rather neglected by the Labour hierarchy over the last year.
Campaigning is clearly stepping up a gear. The expectation is that the election will be called on Tuesday, and then politicians will have exactly a month to try to win over undecided or cynical voters. Andrew Sinclair, BBC Look East in Luton South.
And if the Prime Minister does indeed call the election next week, Look East is ready to bring you up detailed coverage of the campaign where you live. We're going to have expanded TV bulletins, and we've commissioned a series of special reports looking at the big questions affecting our region. The full details next week.
Still to come here